Welcome to Section 17 of Psychiatric Pharmacology. In this section, we'll be discussing lithium. This story takes place at a lithium-ion electronics store. There's a sign here advertising their newest product, a lithium-ion smartphone, equipped with the newest charging technology. Well, this lithium-ion sign will be our symbol for lithium. The display table is quite unique in that it appears to be floating above the ground. Notice that the table has no legs holding it up. And one customer is extremely confused about this as she stares at this floating table. Well, this confused customer questioning the mechanism of this table symbolizes the unclear mechanism of lithium. We're still not completely sure about lithium's mechanism of action. All we know is that it has something to do with inhibiting the phosphoinositol cascade. But that's not something you need to memorize because we're still not sure. There's a statue of two polar bears as the centerpiece on the table to showcase the new frosted colored phone. One bear, the one holding the new phone, is visibly happy and upbeat. The other bear, the one not holding the phone, is depressed and empty-handed. Well, two polar bears on opposite ends of the emotional spectrum are our recurring symbol for bipolar disorder. So these two bears should help you remember that lithium can be used for bipolar disorder. One store employee is setting up the display and ensuring that everything is properly placed. He's got a protractor held at an acute angle to ensure that the phone is properly placed on the happy polar bear. Well, the happy, upbeat polar bear is our symbol for mania in bipolar disorder. So this acute angled protractor on the happy bear should help you remember that lithium can be used for acute manic episodes. This display table also has the store's newest tablets on display. These tablets have images of golf balls on tees to showcase their excellent resolution and picture quality. However, one customer is visibly unimpressed with the quality of the picture, so he gives it a thumbs down. It's not good enough for me. Well, the tablet with the 3 golf balls and tees is our symbol for T3, while the tablet with the 4 golf balls and tees is our symbol for T4. And this unimpressed man giving the tablets a thumbs down should make you think of T3 and T4 inhibition. So putting this all together, this should help you remember that lithium is a goitrogen that inhibits T3 and T4 release from the thyroid. One of the iPads on display is displaying a very detailed video of a tarantula to showcase the improved resolution and picture quality of their product. A tarantula is our recurring symbol for teratogenic. So this tarantula should help you remember that lithium is teratogenic. Now, customer is so startled by how real this tarantula looks that he jumps backwards and hides behind the narrow window to escape. This narrow window should help you remember that lithium has a narrow therapeutic window. This just means that there's a very narrow window for the serum concentration of lithium to be effective without being toxic. So again, lithium has a narrow therapeutic window. Construction worker in the background is measuring the angle of a window with an acute protractor to make sure the angle of the window is acute. As mentioned before, this acute protractor is our symbol for acute, and so this is where we will be discussing the symptoms of acute toxicities caused by lithium. Unfortunately, we see that one customer is super sick and has to sit down on the table. Her face is visibly green and she looks nauseous. It's unfortunate that this poor electronics store has to deal with a sick customer, but I'm glad they're well staffed with medical personnel so that they can take care of any sick customers. Well, this nauseous woman should help you remember that acute lithium toxicity can cause GI distress, which includes nausea, vomiting, and diarrhea. We can see through the store window that there's a taxi parked right outside of the store. The taxi is our recurring symbol for ataxia, so this taxi should help you remember that acute toxicity can cause ataxia. Some crazy guy entered the store and tried to get high by breaking open a lithium-ion battery and drinking the contents. He's now holding the broken battery and has battery juice all over his mouth. He's trying to say something, but no one can understand what he's saying, since his speech is slurred and garbled from battery juice in his mouth. Well, this weird guy's slurred and garbled speech should help you remember that acute toxicity can cause slurred speech. Well, this sick, nauseous woman sitting on the table is clearly freaked out by this crazy guy drinking that battery fluid. And so she points to him with trembling hands. She's like, "Doctor, do you see this?" Well, this lady's trembling hands should help you remember that acute toxicity can cause tremors. The taxi driver outside of the window is confused about all of the commotion that's going on inside. He sees some weird movements through the window, but he doesn't understand what's going on. So he's scratching his head and has question marks above his head. Well, this taxi driver's confusion should help you remember that acute toxicity can cause confusion. The store's phone is ringing like crazy, but no one's answering it because they're all focused on the sick woman. A ringing phone is our recurring symbol for seizures, since it looks like the phone is having a seizure. So this should help you remember that acute toxicity can cause seizures. The doctor is doing a physical exam of the sick woman and checks her patellar reflexes with his reflex hammer. When he does this, her leg kicks straight up very quickly, as you can see with those motion lines behind her leg. Well, this lady's hyperreflexic knee should help you remember that acute toxicity can cause hyperreflexia. Fortunately, this sick woman is also being treated with an IV of normal saline. This bag of saline should help you remember to treat lithium toxicity with aggressive isotonic sodium chloride. Now let's talk about chronic toxicity. We see through the window that right across from the electronics store is a restaurant called DIN, as in, this is where you can get some dinner. Well, this DIN restaurant is our symbol for nephrogenic diabetes insipidus. So you can think diabetes insipidus, nephrogenic type, DIN. So this store name should help you remember that chronic toxicity can lead to nephrogenic diabetes insipidus. Now we see that there's a shirtless man waiting outside of the DIN restaurant for his reservation to be ready. He isn't wearing anything except for a bow tie, so he's cold and shivering. And notice that he's holding a bag in his hand that says Ion Store, indicating that he had already purchased something from the electronics store and is now heading to dinner. Well, this Ion Store bag he's holding should remind you that we're still talking about lithium toxicity. And the fact that he's across the street by the DIN restaurant should help you remember that we're talking about a chronic toxicity. And a bow tie like this is our recurring symbol for the thyroid. And the fact that this male stripper has untied his bow tie and it's now hanging down like that represents low thyroid or hypothyroidism. And the fact that he's cold as he's saying brr represents one of the symptoms of hypothyroidism, which is cold intolerance. So just remember that chronic toxicity of lithium can cause hypothyroidism. You'll notice that this male stripper standing outside the DIN restaurant is wearing a very large cowboy hat. This big, prominent, ostentatious cowboy hat will be our symbol for neurologic symptoms and represents the idea that neurologic symptoms in chronic toxicity is very similar to those seen in acute toxicity. For example, ataxia, confusion, and slurred speech with that guy that was drinking the battery juice. Off to the right, we see that the store's bathroom is open, but the toilet is taped off, meaning that it's out of order. The urinal, however, is not out of order and is open for use. Well, the open urinal should make you think of urination or excretion to help you remember that lithium is excreted through the kidneys and not through the stool. And that makes sense considering lithium can cause nephrogenic diabetes insipidus with chronic use because it goes through the kidneys. We see that there's a customer who's holding up a bun in one hand and a credit card in the other hand. He's ready to pay, so he's waving his credit card up in the air to get the attention of a sales agent. This man's bun is our symbol for blood urea nitrogen, or BUN, and his credit card is our symbol for creatinine, or CR. So this man should help you remember to monitor levels of BUN and creatinine, which are renal function tests. And that makes sense considering this is excreted through the kidneys. And you need to make sure that the kidneys are functioning well in order to prevent toxicity of lithium and also to ensure that the lithium is not damaging the kidneys. One customer is standing in line for the bathroom and checking his phone battery while he waits. Well, this customer monitoring his lithium phone's battery should help you remember to closely monitor serum lithium levels. And that would make sense that you would want to monitor these. After all, lithium, as we mentioned at the beginning of the lecture, has a very narrow therapeutic window. We also see a lithium-ion table with food and salt on it. This table of food is for the guests to snack on as they browse through the store. And notice that the snack table is made of PVC pipes. These PVC pipes are the recurring symbol for proximal convoluted tubules of the kidney, or PCT. And a salt shaker is our recurring symbol for sodium channels. So this PVC snack table with the salt shaker should help you remember that lithium is reabsorbed in the proximal convoluted tubule through sodium channels. We see that there's an elderly woman at the snack table eating kidney beans and raising her hand to get the attention of a store employee. Well, this lady eating kidney beans represents kidney damage, and her hand raised combined with the lithium-ion table should make you think of increased lithium toxicity. So this should help you remember that kidney damage can increase lithium toxicity, and that makes sense because lithium is excreted through the kidneys. So if the kidneys are damaged, lithium will build up in the serum. And the fact that this woman is elderly should help you remember that elderly patients also have an increased risk of lithium toxicity. A mischievous kid is wreaking havoc throughout the store by taking the store's water bottles and dumping out the water all over the place. And we see that he's currently dumping out 2 bottles of water. Well, this annoying kid depleting the water bottles of water should help you remember that volume depletion can also increase the chance of lithium toxicity. The store has placed a lithium-ion battery display on the snack table that accidentally caught on fire. Well, a firefighter has arrived and he's wearing a tie-dye t-shirt and brought his fire extinguisher. Apparently he was off duty when the fire occurred, so he's not in uniform. However, this firefighter is unable to put out the fire, as we can see by the fire raging on. Well, the tie-dye is our recurring symbol for thiazide, and a fire extinguisher is our recurring symbol for NSAIDs. especially when they're held by somebody super scrawny and obviously not using steroids. In other words, it's a non-steroidal anti-inflammatory drug, or NSAIDs. And this firefighter who's unable to put out the fire is our symbol for drugs that decrease renal clearance. So putting this all together, this firefighter should help you remember that drugs, such as thiazides and NSAIDs, that decreased renal clearance will actually increase serum lithium levels. There's a little girl sitting on the floor playing with her cards when the firefighter accidentally stepped on one of her playing cards. She tries to yank the ace card out from under his foot, but ends up ripping it in the process. Well, this ripped ace card is our symbol for ACE inhibitor, and should help you remember that ACE inhibitors are another class of drug that can decrease renal clearance. Now, the scrawny firefighter brought his Dalmatian with him, who has a big liver-shaped spot on him. One curious little toddler is poking the Dalmatian's liver-shaped spot with a fibrous branch. Well, a liver-shaped spot is our recurring symbol for the liver, and this kid poking the spot with a fibrous branch symbolizes a fibrous liver, or cirrhosis. So this should help you remember that cirrhosis can also increase toxicity. We can see that there's a maintenance man under the snack table trying to clean up all the water the annoying kid spilled, and he's using a sump pump to do it. Unfortunately, his pump is broken, since it's not absorbing any of the water. Well, a broken pump is our symbol for heart failure. So this should help you remember that heart failure can also increase the chance of lithium toxicity. And that concludes our story on lithium.